Good afternoon, everyone. My name is Tarnika Manning, and I'm the Community Outreach Manager with the Metropolitan Chicago Breast Cancer Task Force. We're a nonprofit organization fighting to eliminate disparities in breast cancer for women of color. To learn more about our organization, give us a call at 312-942-3368 or look us up on the web at chicagobreastcancer.org. You can also find us on Facebook as well as Twitter, with our handles being MCBCTF. You're watching a live call-in television program brought to you on cable channel 21, and we are online at cantv.org/hotline. During our show, we will discuss various breast cancer issues and health issues that affect women of color here in Chicago. I invite you to call in with your questions at 312-738-1060. Our phone lines are open, so call us if you have any questions. Today, our guest is Herr. Correct, right? We were practicing before the show came on. So. Katie is the AmeriCorps Program Director with the Public Health Institute of Metropolitan Chicago. She's going to tell us more about the Chicago Health Corps program and how you all can get involved with some of the initiatives they have. Again, at any time you have any questions, give us a call, 312-738-1060. All right, so welcome.
Thank you. It's great to be here.
Thank you for being our guest today. All right, so can you tell us a little bit about your background?
Yeah, sure. So I'm originally from Chicago. Well, not really Chicago, I shouldn't say that. I'm from Evanston. People get mad when I say I'm actually from Chicago. I'm from Evanston originally, but I've been a Chicago resident on and off for the past 10 years. I actually moved back to Chicago in 2006 to do an AmeriCorps program with the American Red Cross. So I've been around for a while, and AmeriCorps is familiar territory for me. My background is in public health, and so before my role now, I really focused on issues around food access, nutrition, and just general food systems. So that's really where most of my professional experience has been.
Great. There's a lot of area around that. I'm pretty sure with your program you get to still touch on that area a lot.
Yeah, a little bit.
All right. So what is your role at the Public Health Institute of Metropolitan Chicago?
So, yeah, sure. So first, the Public Health Institute of Metropolitan Chicago is an organization that's really focused on addressing critical health challenges, mostly through building organizational capacity of its partners and really strengthening the healthcare infrastructure in Chicago. One of the ways that they do that is through administering the Chicago Health Corps, which is a local site of a broader program called the National Health Corps. So my role is really to oversee the day-to-day operations. So I do a lot of the administration and the program management, but really the fun parts of my job are building the relationships with our host sites and overseeing the members. We have 21 members this year, and we'll have 20 next year. So I get to help do member training and development and provide mentorship and additional support.
That's awesome.
Yeah.
So I know people hear a lot about AmeriCorps. Can you just tell us a little bit about what AmeriCorps is and what's the difference between some of the other programs we hear about?
Absolutely. Yeah, it can be really confusing. But AmeriCorps is a national service program that's a program of the Corporation for National and Community Service. So a lot of people have heard of the Peace Corps, which is similar insofar as that it's really focused on meeting critical needs, whereas AmeriCorps is focused more domestically. The Peace Corps is really looking internationally. But it's also important to remember that AmeriCorps isn't just one program. That's where it gets kind of confusing. It's a suite of programs. So essentially, different organizations and programs apply to get AmeriCorps funding. And so when they're granted that funding, they then design their own programs within the guidelines of the AmeriCorps requirements. And so the areas that they're focused on, they have 3 different AmeriCorps branches. So that's where it gets even more exciting, right? So there's 3 different types of AmeriCorps programs. There's state and national direct, which is one of what the Chicago Health Corps is. And that's really focused on direct service. So going out into communities and providing services and education, et cetera. And the main kind of areas they focus on are health, education, let's see what the other ones are, environment and economic development. So those are kind of the big areas. There's also the VISTA program, which a lot of people have heard about, and that actually came around in the 60s. So it's been around for a long time. So the Peace Corps was first started, and then decision makers got together and were sort of like, we could probably use a program like that here. So that's where Vista came from. And that's more kind of behind the scenes, building the capacity of organizations to be able to fight poverty. Okay. And then the last one is NCCC, which came out of the Conservation Civilian Corps, kind of under Roosevelt. So this idea of like building trails and doing some of the infrastructure projects. So it's more project-based. And you'll see NCCC a lot doing things like responding to national disasters, etc. So that's really the focus of the 3 different branches of AmeriCorps. So hopefully I didn't confuse you more.
No, I learned a little bit of something. I think we actually have a caller. Caller, you're on.
Sure.
Good evening, ladies. Can you hear me?
Yes.
I live on the south side of Chicago, and we have some problems due to food that have a lack of nutrition in it. And when you look at certain studies, especially on the south side of Chicago, we are in a situation now where we have children in much more earlier life qualifying for disability because of poor health issues they have in terms of diabetes, in terms of maybe heart problems and other problems as well. And you would think that they would put certain types of foods on the south side that would take care of certain health problems. Now, we're looking at children that are going to have a much more shorter lifespan than their parents.
Mm-hmm. Okay. So I think I was kind of just touching on Katie's background working with food systems. I'm pretty sure that you have a lot to talk about that.
Yeah, I know.
But you can touch a little bit about. Yeah, me too. Yeah,
and you do too. We just came from a conversation about some projects that have been happening throughout Chicago.
Yeah.
You touched on a lot of really great points, and I'm not fully prepared to kind of talk about them in any depth today. But I do know, so this is going back to kind of my program. We used to have another AmeriCorps program. Currently, we're only running one, and it was just focused on that in the way that this is such a huge issue, and AmeriCorps has been a really big supporter. There's an AmeriCorps program that's not through us, but another one called Food Corps, and it's focused on building gardens in schools and helping kids eat healthy meals and making sure that they have access to them. And that is, I think it's got to be a united front. As you said, this is one of the biggest issues facing our nation today. And I think there's a lot of programs out there. You hit the nail right on the head. This is important to our kids' future. And I think, AmeriCorps is just one of the organizations that's really trying to address this issue head on.
Thank you, caller. All right, so you mentioned that your program is called the Chicago Health Corps. So can you tell us a little bit about that?
Yeah, sure. So the Chicago Health Corps is actually a program that's connected to the National Health Corps. So there's 4 operating sites. There's one in Philadelphia, one in Pittsburgh, one in North Florida, and then the Chicago Health Corps here in Chicago. So both the National Health Corps and the Chicago Health Corps have been around for 20 years in one capacity or another, although that's changed. So AmeriCorps was started in 1994, and the National and Chicago Health Corps have been there the whole way along. The way that we operate, as I said, every AmeriCorps program is different, but the way that we operate is that we have a host site model. So we actually, for example, partner with the Metropolitan Breast Cancer Task Force. We have a member placed there. So our strength is really in our partnerships, which I'll talk at some point, I'm sure I'll mention a little bit more about, but I also want to talk about our members. Okay. So we have 20 members in our cohort, and what they do is they commit 1,700 hours over a 10.5 month term of service to giving service at their host sites. The majority of the time is spent at their host sites, but they're also part of a program. So we have in-service training days and additional program components that our members are part of.
Great, great. Again, if you have any questions for Katie, we are live. You can give us a call at 312-738-1060. So you mentioned the task force is actually a host site. So can you tell us about any other organizations that are partnered with the Chicago Health Corps?
Sure. So we actually this year, every year it's a competitive application process, but this year we have 10 really strong host sites. And we partner with a wide range of organizations. So we partner with several federally qualified health centers. So our biggest partners right now are Heartland, Erie Family Health Center, and the Fantas and Cicero clinics. And so we do a lot of work with them. Our members are in the clinics. We also have many of them are placed at school-based clinics. We also work with nonprofits focused on specific diseases or different types of interventions. So, for example, the task force is one. We're also with the Respiratory Health Association and the American Cancer Society. And so they obviously are focused on kind of specific diseases, whereas Smart Chicago is actually really focused on increasing access to technology. And so our members are using technology to help people improve their health. And then I'll just shout out a couple other partners that we have, because we have a lot. We have a member place at Advocate Trinity Hospital on the south side. And then I don't want to lose any. Oh, and then we actually have really strong partnerships with the Chicago Public Schools. So we have a member at the Office of Student Health and Wellness and the Princeton Vision Clinic.
Oh, great. And funny enough, most of your partners are our partners too. So we
it's a small network.
Yeah. We all work together, so it works well.
Yeah, absolutely.
So what are some of the responsibilities for a host site?
Sure, absolutely. So our host sites are really responsible for developing a position description. So while our program has definitely specific parameters and things that we're looking for, we really want a member to fill a need of the host site so that they can kind of go above and beyond to increase their capacity to reach a new population or enhance their project in some way. So they are the ones who are charged with coming up with the position description that we call it, since it's not a job, it's a service term. Where they outline the member activities. And so then when the member arrives, their role is, fulfilling that position description. And when they're there, the host sites are certainly responsible for the administration, et cetera, but really providing that training and mentorship for the member as well.
Okay, great. So we had a caller that was calling from the South Side, and he was talking about some of the issues they have on the South Side as far as access to healthy foods. So I know when you were selecting host sites, are there any targeted populations that you're hoping to serve, or?
Sure. So the Chicago Health Corps is really committed to serving Chicago's medically underserved, for lack of a better word. That's typically in low-income neighborhoods. So, we really do kind of like the task force. We know that different diseases impact different communities in different ways, and it's not all equal. So we're really focused on organizations that are working to close that health gap.
Okay.
So that's our biggest focus area, which is pretty broad. Kind of naturally, we have created a really strong network within the Chicago Public Schools. So as I said, we have several members at school-based health centers, also directly through the Chicago Public Schools. So again, that's just kind of happened organically, but it's, there's a huge need in our schools for our students and for their families. So we've spent a lot of time there.
That's definitely a big need. I think we have a caller. Caller, you're on the line.
Good evening once again, Katie. There's a slight problem, and I'm just curious because Chicago Public Schools still have vending machines in their schools, and a lot of the stuff they have in those vending machines is unhealthy, and that's an issue that needs to be taken care of. When you think that issue going to be taken care of, I understand they give a part of their budget may come from the income for those machines, but when that issue may be, you think, going to be taken care of?
So I can't answer that question directly. And again, I'm sort of speaking a little outside of my depth, but so don't completely hold me to this. But based on some of what I know, I do know that the Chicago Public Schools has an Office of Student Health and Wellness. It's really invested in healthy food in schools. Now, this is something that's going on across the country. So it's a big effort, and it's much needed, like you said, but it does take time to kind of shift what people have been doing for a really long time and prioritizing healthy food. I've been able to see firsthand through some of our members' work, is starting with educating staff at public schools who are in food services about what is healthy and what isn't healthy. Doing some, as I mentioned, food courts in schools, doing community gardens, and really exposing children to, different healthy vegetables that they might not have had otherwise, and really setting that foundation for a healthy adulthood, really. That having been said, I know there are policies in place. Whether or not they're being fully implemented, I think that's always kind of the longer term strategy. And you can probably speak to this as well.
I was going to say,
better.
I know we were just discussing that they had a AmeriCorps member in Blue Island, and they worked on a lot of policies as far as vending machine policies, when the vending machines were going to be on and what was inside the vending machines. Because just because there's vending machines there doesn't mean that there are unhealthy items in there. So a lot of the vending machines at some of the high schools in Blue Island have more water than anything. So it's not necessarily a bad thing to have water available for students.
Right.
And also, if you are a parent, I would get involved so that you can also influence policies throughout the school as far as the access to food, as well as community gardens being established. So, yeah, get involved, definitely.
Yeah, and I would point you to the Healthy Schools campaign.
Yeah.
It's an organization in Chicago that's really dedicated just to the issues that you're talking about, and what that looks like in our schools. And I can anecdotally tell you, I was at a host state visit in one of our schools a couple weeks ago, and they were planning a campaign for teens to get themselves tested, but they wanted incentives of food. And in the conversation, they were discussing what kind of food they could use to entice students to participate. And the conversation was around like, well, we now have these healthy snacks policies. So, what can we do within these guidelines? So I'm assuming that it's not perfect, but I can tell you that there are efforts being made.
All right, I think we have one more caller.
Hello.
Hi.
Hi. I was wondering if you all are familiar with the program Rethink Your Drink.
Yes.
Yes.
Yeah, okay. I was, Lisa, I became an ambassador, so to speak, for the program after I went through the training. I haven't heard too much from them or what to do because of that, but I am upset a little bit because the program is needed. It is needed, and, where school where I work, you see so many children going to the corner store and continuing with the high price of water as well as soda. They choose soda outside of water because why spend so much on water? That should be dealt with. And it needs an immediacy because the children who are growing now and becoming sick and ill at an early age, they need to understand that drinking water is highly and much, much, much more important than drinking these expensive sodas. And it makes no sense to me that it takes so long to implement such a program. That is needed if we're talking about saving our children, if we're talking about doing what we can to bring about the important changes to them. So hopefully they will bring that back up because, especially in Chicago Public Schools, it is needed.
They have a lot of suggestions and projects for you all.
Yeah,
that's definitely a great project.
Absolutely.
Can you tell us about who typically signs up for the Chicago Health Corps?
Yeah, sure. So, while there isn't just one specific member, we do have kind of a general demographic. Most people are pretty early in their careers, so we're doing member recruitment right now, and the vast majority are straight out of college, and this is their opportunity to get some really hands-on experience. So our members are typically interested in pursuing a health career, so whether that be med school or going into public health. Although that's not, again, 100% the case. We certainly, we have a lot of our host sites work directly with youth, and so that's what really entices people into joining the program. But across the board, our members are really committed to giving a year of service. So they want to give back, and they want to be helpful in the communities where they're serving. So I think, typically fresh out of college, but that's not, again, we don't screen for that. That's just kind of how it's happened. But definitely a commitment to service and usually a pretty strong interest in health.
Okay. So what are the requirements to become a member?
Sure. So AmeriCorps itself as the national program, and I'm going to read these just because they're not complicated, but I don't want to misrepresent. So to be an AmeriCorps member, and that's just not with the Chicago Health Corps, that's with any AmeriCorps program, an individual needs to be at least 18 years of age, be a U.S. citizen or legal permanent resident, and has a high school diploma or GED. So those are the basic requirements for AmeriCorps. Our program has, we hold the basic eligibility requirements, but we also have a pretty extensive interview process just to make sure that the candidates are a right fit for us and that we're the right fit for them.
Okay. And so how are other members compensated for their time? Because how long is the period?
Yeah, so it's 10.5 months, so 46 weeks. And we, our members receive what is really the basic AmeriCorps stipend. Most programs are around this, but this is the kind of AmeriCorps requirement. So they receive $12,100 over the 10.5 month period, which is certainly a modest living stipend. And they also are eligible for different benefits like health insurance provided free of cost if they need it. And there's some additional benefits if they're eligible, such as childcare. What really attracts a lot of members is that there is a $5,645 education award on the other side of the program. So once members complete the program, they have that money that's good for up to 7 years, either to pay back previous education debt, yeah, right, which can be really helpful, or to use for future academic pursuits. So I was an AmeriCorps member. And I did go back to school and found that education award extremely helpul.
Oh, great, great. You know, I was going to ask you, did you have any successors? But you're your own successor.
I'm working on it.
All right, so what type of work does a AmeriCorps member expect to do when they sign up for Chicago Health Corps?
Yeah, absolutely. So we have all of our host site position descriptions posted. So while we are certainly interviewing people to see if they're a good fit for our program, they also, it's a match process. So they get to look at the position descriptions that look interesting to them. So each host site is pretty unique. We do have a broad variety of different position descriptions at the organizations, but what's universal is that our members are doing direct service. So they're working directly with community members, either providing services or making sure that they're able to be connected to them. So some examples, we really want to make sure that our members are connecting kids and adults with health and social service programs, particularly, and also providing education that really empowers people to take charge of their own health. So that's very vague. I can give some examples, although it's not an all-inclusive list. So some of our members are involved in helping people establish medical homes, particularly with all the changes with the Affordable Care Act. There's been a lot of changes. And so they're there providing people support to kind of help explain the process and make sure they're connected to what they need. They do group health promotion and disease prevention education for youth and adults. So we have members in the community teaching kids how to manage their asthma, to nutrition. We do a lot of nutrition education and sexual reproductive health, lots of different topics. And then they'll also do some follow-up case management and support. So we know a lot of people need some additional help getting transportation to get to their appointments or whatever it might be. So our members are really involved in providing kind of that extra support to make sure that people are able to access the things that will help them be healthy.
All right. So if someone is interested in applying to be a AmeriCorps member or even a host site, how do they go about doing that?
Sure. So I will direct everyone to our website. There's a couple different ways to do it. If you're interested in becoming a member, our application process is actually currently open. It's open until Friday, but if you're just seeing this now, you can email us at AmeriCorps. What is our email address there? It's AmeriCorps@phimc.org. But we do have an application process that's all online. So for members or applicants who want to be members, you'd need to apply through the AmeriCorps portal. And so you'll fill out a general application that will come. You can select it to send it to our program, but if this piques your interest in other AmeriCorps programs, you can use that same application to send to other programs. So the website for that, if you need a pen, it's nationalservice.org/programs/AmeriCorps/join AmeriCorps. But if you just Google AmeriCorps, you can get there too. That's probably the easiest. If you're specifically looking at our program, you're going to want to visit our website to learn more about us, just to make sure that it's a program that seems right for you. So that's nationalhealthcorps.com/Chicago Health Corps. And so all the instructions you need to apply to our program and more about it is up there. And that's true with host sites. We're not actually recruiting for host sites currently, but we do, as I said, have an application process every year, and that usually goes out around January or February. And so all host sites will complete an application and come up with a position description at the time.
Well, hopefully next January, someone in food systems will apply so we can get some AmeriCorps members out there addressing some of the issues that our callers had today.
Absolutely.
So this is great. Is there any additional information that you want to share with our audience before we sign off?
Yeah, I think AmeriCorps is a really great, as I said, it's a really great program. We're often behind the scenes. So I encourage you to learn more about it. Our hashtag for AmeriCorps is getting things done. And that's really what our members do. So if you ever have the chance to provide, to let your decision makers know that this is a really valuable program that is getting things done throughout Chicago and really across the country. And I also just want to thank you for having me today.
Problem. This is great. Definitely, like, we had a lot of interest in your background.
Yeah,
so.
totally.
You have to come back and actually talk about some.
I know. Do you guys? No, I'm not going to say that.
But we want to thank you for being a guest today.
Yeah,
this was
thanks
wonderful.
so much.
All right. But if you would like more information about the topics that we talked about today, give us a call. We're at 312-942-3368. Also, check us out on our website, chicagobreastcancer.org. And we are also on Facebook and Twitter, where our handles are MCBCTF. I'd like to thank you for watching today. Please tune in next month, where we'll be back like we are every third Tuesday at 5 p.m. discussing health issues here in Chicago. My name is Tarnika Manning from the Metropolitan Chicago Breast Cancer Task Force. Thank you and have a great evening.